Occlusion and Malocclusion in dentistry. Hello and welcome to our discussion on occlusion and malocclusion in dentistry. Today, we'll explore the fundamental concepts of how teeth come together and the common issues related to their alignment. Let's dive in. Definition of occlusion. Occlusion is the precise relationship between the upper, maxillary, and lower, mandibular, teeth during functional activities. It describes how teeth are aligned and fit together during various activities. In an ideal occlusion, maxillary teeth should slightly overlap mandibular teeth. Cusps of upper molars should fit into the buccal grooves of lower molars. The midline should be aligned. Malocclusion and its causes. Malocclusion, the abnormal positional relationship between maxillary and mandibular teeth, is often hereditary. It can result from disproportionate jaw size, abnormal tooth size or spacing, abnormal tooth eruption. While not all malocclusions require treatment, correcting them can enhance a patient's appearance, ease of cleaning teeth, and reduce the risk of oral diseases. Edward Hartley Angle's classification. Orthodontist Edward Hartley Angle introduced a classification system based on the occlusal relationships of permanent first molars. The classifications are as follows. 1. Class 1 occlusion, considered ideal with a normal antero-posterior relationship. Mesiobuccal cusp of maxillary first molar occludes into the buccal groove of the mandibular first molar. 2. Class 2 occlusion, maxillary teeth appear anterior to the normal relationship. Divided into Class 2 Division 1, protruded teeth, and Class 2 Division 2, intruded central incisors. 3. Class 3 occlusion, mesiobuccal cusp of maxillary first molar occludes distal to the buccal groove of the mandibular first molar. Results in a prognathic profile. Overbite and overjet. Overbite, vertical overlap of maxillary teeth over mandibular teeth during centric occlusion. Overjet, horizontal protrusion of maxillary teeth beyond mandibular teeth during centric occlusion. Radiographic anatomy, anterior midline region. Incisive foramen, contains nasopalatine nerve and blood vessels. Median palatal suture, radiolucent line between central incisors. Nasolabial fold, light radiopacity bisecting central incisors. Radiographic anatomy, canine region. Inverted Y, represents the flow of the nasal cavity and anterolateral wall of the maxillary sinus. Nasal mucosa outline, radiolucent line separating nasal turbinates and mucosa. Radiographic anatomy, molar region. Malar shadow, U-shaped radiopaque structure representing zygomatic process. Maxillary tuberosity, behind the second molar, covered by mucosa. Zygomatotemporal suture, delineates the anterior part of the zygomatic arch. Radiographic anatomy, internal, aspect molar region. Inferior alveolar canal, radiolucent canal containing the inferior alveolar nerve and blood vessels. Stepladder trabecular pattern, variation of normal trabeculae seen between roots. Common, radiographic, artifacts. Anatomic artifact, produced by incorrect horizontal or vertical angulation. Enamel pearl or pulp stone, mistaken for anatomical artifact, especially at bifurcation. Conclusion. Understanding occlusion and malocclusion is crucial in dentistry. These concepts help guide orthodontic care and ensure optimal oral health. If you have any questions or concerns about your occlusion, don't hesitate to consult with a dental professional. Thank you for joining us in this exploration of dental occlusion. Stay tuned for more informative discussions.